The Beaumont Foundation is really proud to be a funder of the Build Health Challenge. We've been one of the founding partners since 2014, and really we're interested in being at the table because we know that all health is local.
Missouri Foundation for Health joined the Build Health Funding Collaborative because it really aligns with a lot of how we think about equity, how we address health, and really think about systems change. Health equity is looking at different disparities impact health and how people experience those types of issues differently and can really impact their health outcomes and their health conditions in a negative way.
Bad policies have created bad and poor health outcomes for so many people, and particularly marginalized communities and communities of color. I think that as a foundation, we realize that health equity for us means putting our resources in the hands of communities who know what needs to be done to advance policy, to advance practice change, and support the systems changes that will produce positive health outcomes for the most people. Build's doing that because it's allowing communities to come with their own ideas for solving their own health challenges.
And so not coming in as a funder saying we have the answers, this is what the community needs to do, but really being an active collaborator with community and kind of trying to elevate power equitably and eliminate power dynamics between funders or other institutions that may have historically and traditionally held power, but really working more closely with community.
What Build allows is it to be a back and forth. It's a constant evolution of understanding what community needs, what institutions can bring to the table, and sort of how institutions, whether that be the hospital system, whether that be the philanthropy, can use their networks and the connections they have with policymakers, with other funders, at the local and national level to drive the changes that they know communities are asking for, and bringing communities to the table with them in partnership.
So being able to provide those resources, but designing them in such a way that it's community informed, community engaged, community driven, can also not just shift how philanthropy thinks about it, but how other institutions who may have investments or resources at their disposal, how they can also work to address community health.